We still have so much to learn about the coronavirus. Why do some people die while others have no symptoms? What is the primary mode of transmission? I am joined by Dr. Shelli Farhadian. She's an infectious disease expert at the Yale School of Medicine who is studying all of those questions. Welcome, doctor.
Thank you, Kara. Thank you for having me on today.
Tell us about the new biobank of COVID samples you're studying and how people can help.
Our study is called IMPACT, which stands for Implementing Medical and Public Health Action Against Coronavirus in Connecticut. And our goal really with this study is to develop a large biobank so that we can collect the information and the samples that we need in order to better understand so many aspects of COVID-19. So beginning with the first patient who was admitted to Yale back in March, we've approached all patients who are admitted to Yale with COVID-19 and asked them if they'd like to volunteer for the study. And those who do provide blood samples, saliva, nasal specimens, which we're collecting and storing in this biobank to make available for researchers who are asking about epidemiology, modes of transmission, as you said, and disease outcomes. The effort is led by Dr. Albert Coe at the School of Public Health.
And have you learned anything yet about the primary way people are infected?
So some of our efforts have focused on different specimens and which ones carry virus in them. And we're looking at this both to understand how the virus is transmitted and also how we can best test for the virus. And so one of our exciting findings is the possibility that saliva could actually be used as a quick, easy, non-invasive test rather than the nasopharyngeal swab, which I'm sure many of your viewers have had to do, and as they know, is very uncomfortable.
Yeah, and what about pregnancy? In our last 30 seconds or so we have with you, what have you learned about pregnancy and COVID?
As you know, there's so much we don't know about this virus, and specifically, we don't know very much about how it affects pregnant women. We've been fortunate that volunteers at our hospital, pregnant women, have donated their placenta and cord blood for our study, and we're looking into whether the virus actually infects the placenta and whether there's a possibility of outcomes related to that.
So bottom line, you would like people to donate and be part of the study if they are able. What's the best way to do that?
So right now we're primarily focused on hospitalized patients. And so for those, we're going to be working with your doctor in the hospital to approach volunteers to donate their blood and other specimens. And we're so grateful to the community for participating in that way.
All right. Thank you, doctor. And we look forward to finding out more about what your study uncovers.
Thank you for having me.